And the onset, I'd like to thank the airways and for giving such a special hall for something which was considered not very significant many years back. Virtually now, I think tears form a very important part of a refractive outcome, whether you do any kinds of surgery. More advanced refractive surgeries or more complicated or more sophisticated optics of multifocal surgeries, the outcome always depends on kind of tears you have. I think that's the realization today, and thanks AIOS for this opportunity. And this is also a sponsored session, and personally I don't have any financial disclosure to make with this company or any of the products, even though being associated with them for research and many academic events in the past. So what I'm going to discuss today is just a 5 slides from my side, and then it's going to be taken over by a very eminent panelist and people who have worked on tears from an optical point of view and also from a clinical point of view. And this slide is again going to be discussed by my colleague, which just tells the source of what all you can find in the tears. It's just not dry eye, it's beyond that today. The reason is, it's just like urine. Probably once upon a time, when people were looking at urine or urine examination or blood examination, this is probably what they were thinking. How many things can you find out in that? And today, virtually from serum magnesium to everything you can find out there, and that's exactly what is going to happen in times to come. The whole workflow is when you take the Schirmer strip or you take the capillary drop, or you can just look at the profiling which is done in the labs. It looks complicated, but if you go back and see a few years back how urine analysis was done, exactly probably it would have scared everybody, but that's the way we move and that's the way it's going. And again, many slides may overlap. This is about the Schirmer strip and how it's important to find out a lot of things happening in the tears using the right amount of approach if you can follow it in your laboratory. And virtually every marker is expressed on your tears in the cornea itself, and we have published some of this work about inflammation and about the strength of the collagen, and even kind of trying to question the most debated question is keratoconus inflammatory one. And coming to my last slide, it's about virtually the questions what we keep asking all the time is, why is something unpredictable? Why is something behaving not so to my liking? Why some surgeries fail? And as we go deeper beyond tears, there are also vitreous and aqueous, which also could find also place in how it actually can be translated into biomarkers. So question always is, why should we do all this? The only answer, I keep this slide always as my last slide, is the only evolution is the adapt to change. Only if you try to change and change your thinking and the way you work, only then probably we can find more answers. Mine was just like a prelude to what is going to come the next 1.5 hours of good discussion with the panel, and I would request all of you to ask questions or clear doubt at any given point of time. Thank you.